Hello, this is my video presentation for NURS 13142 or PEP4, which is a third year clinical component subject for our undergraduate Bachelor of Nursing students here at CQU. Today we're going to be looking at the clinical skill of assessing and accessing a PICC line or peripherally inserted central catheter. Assessment is a really big part of managing PICC lines, and it's something that is well within your scope as a third year student. We had initially planned to do central line dressings, and I know this video is coming a little bit late, but unfortunately due to some technical issues and filming problems, this is kind of what we've had to work with. And as most of you know if you've sat on my classes, I often make comment to the fact that a lot of nursing can sometimes be managing adverse events, sudden change, and just rapid deterioration, and so being flexible and working with what you can to still deliver as best you can is really important. So that's what we're going to keep in mind today. To make it more comprehensive and follow through, I have referenced the Berman's Clinical Nursing Skills Guide. So from page 492, it talks a lot about central venous lines, but page 543, there's a pretty comprehensive skills checklist you can use to follow along to kind of see how we might be doing things. Remember, if you're already working in industry, you might know a different way to do this. It is all really site-specific. However, the Berman's Guide does have a really good, comprehensive, overall aseptic management style that's really good to kind of reference back to. PICC lines are a really unique line. They sit between the happy medium of a peripherally inserted vascular line and a central line. They're typically 20 to 60 centimeters long depending on patient size and need. They travel through a distal vascular access into the top of the superior vena cava. This allows them to bispace smaller vascular systems, reducing vascular damage and peripheral load. Because they sit in the large part of the heart as well, it also ensures maximum delivery of medication, including larger and high intensity volumes. The bacterial ecosystem in the antecubital space makes it much harder for infections to exist within the PICC line other than being inserted, which makes them a really great option for some of the patients you're going to see in your more clinical specialty areas such as oncology and hematology. You may find as an undergraduate student, some facilities are quite hesitant or prohibit undergraduate students from changing the dressing, accessing, or maneuvering peripherally inserted catheters, and some of these facilities even require registered nurses to attend competency-based training packages before they can access them. We don't have much time to go through it in this video, but this can mostly be because that even though adverse events are very rare when the protocol and procedure is followed appropriately, they can be quite significant to the patient. If you read on from your Berman's from 492 and think back to anatomy and physiology, including the superior vena cava, it'll make more sense to you. There's also lots of resources like Life in the Fast Lane and other websites that really explain peripherally inserted catheters really quite well. What you can do as an undergraduate is you can definitely assess the line and understand the rationale and the clinical reasoning behind it. Checking your local policy and procedure is really quite important. This is an old Queensland Health copy, but most states will have something similar, including private organisations and even community settings. Checking your patient chart for medications and fluids that might be administered also helps you get a good understanding of how often you might access the line, why you're accessing the line, and what you might need to consider when doing so. PICC line access is quite important to a lot of patients with PICC lines, especially those needing oncology treatments or long-term antibiotics. It's really important that you discuss with your patient and confirm that they're happy for you to access it, they understand the rationale, and they're on board with the procedure. Patients with PICC lines often have experience with them, they know what to do and what to expect, and they can let you know if they have any concerns. It also really focuses that patient and holistic centered care that we still need even when we do really clinical things. Equipment specifics on what you're going to use to access PICC lines are very different depending on facilities. Traditionally, and in your Berman's, you'll see it's normal saline using sterile syringes, aseptic technique, and the traditional 70% alcohol for swabs or 2% chlorhexidine, which is what we're going to do in this video. So the first one you can see, the first thing we'll do is assess the site. The site assessment is very similar to when you do your peripherally inserted lines. We're looking at the initial insertion site to make sure it's clean, dry, intact, free from redness and swelling. Fresh PICC lines might be a little bit tender at the insertion site and a tiny bit red, but you've known from previous wound assessments you can see if there's a significant change or difference. You'll also see there's two little indicated markings on the actual PICC line. That tells us how far into the skin it's sitting. This is important as it is a tunneling line, and that is something that'll be in your documentation. When we go to actually access the PICC line, we will maintain our aseptic technique. This isn't a sterile procedure, but it is important that we maintain that process at all times, including drawing up normal saline. As I mentioned before, the scrub the hub theory, and just making sure we're looking after this central line, as the risk for infections going into the tunnel is quite severe. You can see when we're doing the push system here, it's called a bit of a pressure push. So that's when you're pushing on a bit of pressure within the actual plunger to create a bit of a tidal. This tries to move any microcluts that are within the line. It's something that we used to do a lot in the older models of PICCs. However, more modern power PICC lines, as we call them, don't have that issue. But it's not a terrible habit to get into, just in case. If you come across a line that you cannot flush, such as this white one, that can sometimes indicate that there could be a clot within the line or even the bung itself. The first thing to do is don't panic. That's not necessarily a good enough reason to remove the PICC, as there are 2 working lumens. We do, however, block off the lumen and let other people know that it cannot be used. This is good for other medications, and if there's an emergency, we don't try and access it in a hurry. As we say in the nursing realm, if you haven't documented it, you haven't done it. That counts with assessment of PICC lines as well. Some facilities might have specialised forms that could have a tick and flick box to kind of get that quantitative assessment altogether, or you could use your nursing progress notes to write a more objective assessment on the site integrity, what you found, any issues, and if you had to change anything. Remember your key points of PICC assessments and how you might incorporate that into your daily practice and your secondary surveys on your patient checks. I'll open the floor to any questions if anyone has anything, and we'll definitely be practicing this in the lab. Thanks for listening.